Well, good afternoon, fellow constitutionalists. In this video today, we're going to talk about, is Canada and Europe's healthcare better than the U.S.? This is in the second video in a series of rebuttals against Bernie Sanders Medicare for All town hall that was hosted by the Young Turks, and also a video response to what the Young Turks were actually talking about in that video. Now, the last video we talked about 36,000 people dying without, because they don't have health insurance if Obamacare is repealed. And I showed how that number is utterly ridiculous to even think it's that high, and there's no way they can even figure that out based on what they were doing. There probably is a way to figure it out, but not according to the way Bernie Sanders and Cenk Uygur had tried to figure it out. So in this one, we're going to talk a little bit about, is Canada and Europe's health care better than the USA? And I'm going to tell you it's not. But Bernie Sanders and the town hall, and I encourage you to go watch it. I know it's kind of hard to watch. I put the links. The links will be down in the video below the video here. But please go watch it. Give them a fair hearing, and also put the sort of like the advertisement video from the Young Turks about it, and some of the comments that Cenk Uygur also made with that. So let's go to this. Let me see here. Let's bring this clip up here, and then we'll make some comments, and I'll share some articles with you after this.
And in all the other developed countries, Norway, one of Donald Trump's favorite countries apparently, they had an expert from Norway on there who was a doctor from there, and they said it's unconscionable to think about not having insurance. People don't understand what that means. So Canada, same thing. So they're like, wait, I don't get it. You just let people die? And our answer seems vicious and deeply immoral to them. Yeah, we just let them die. And there was a doctor earlier in the program, we talked about people who come into the emergency room right before they die. And so the Republicans say, oh, you can go to the emergency room. They're like, yeah, but the person came in, they had no insurance, so they never did checkups. So we never caught their diabetes. So they come into the emergency room to die.
Now, I want to point out something here. Whether you have insurance or not, and I know this is totally just my observation of things, but I know a lot of folks, men and women, who have insurance that do not like going to the doctors. They think they can handle everything on their own, and that's the way they're going to do it. So whether you have insurance or not, you have that problem. Now, I don't know how Bernie Sanders and Cenk is going to fix that. Are they going to force people to go to the doctors? I don't know. And now during the town hall, they keep bringing up the cost and the American cost of health insurance, and how premiums have gone up and how deductibles have gone up. But let me tell you something. Before Obamacare came into being, my deductibles were very reasonable, and my premiums and my business, or the company I was working for, were very reasonable. It was only after Obamacare came in and all the mandates that were put on it that our premiums started to skyrocket and our deductibles started to skyrocket in order to keep the premiums under control. And that was all because of what the government did through Obamacare. There was no other changes in the market forces that normally work their way through the economy. There just wasn't. And yet, Cenk and Bernie Sanders wants to tell everybody that it's an issue of not having insurance that's killing people. And I just want to point some things out here. And you'll see, if you go over and watch that video, it's like an hour and 40 minutes. I know, it's a long time. Have a little tea towel there with you to wipe the blood away from your eyes as they're bleeding from having to watch that. But folks, it's very educational to watch Bernie Sanders go through his machinations on how he supports the erroneous 36,000 people die every year if Obamacare is repealed and there's no replacement. And I've said for years, I said there shouldn't be a Republican replacement. What we should be doing is going more towards a market solution, not away from it. Get rid of the portability law so I can buy, if there's a health insurance policy that fits my family, price-wise, quality-wise, and everything that's being sold out in Arizona, I should be able to, as an American citizen, I should be able to go down to Arizona and buy that policy for my family, or join a group that's not within my state and get group rates through this group without the federal government or my state government going, you can't do that. In the first place, none of their business. Second place, the federal government has no constitutional authority to be governed over anything to do with health care. So Bernie Sanders is wrong on a couple different aspects here, besides the erroneous numbers of the 36,000 are going to die. Now watch this. This is an interactive map here. The United States has, and this is of 2013, 2.554 doctors per 1,000 people as far as population. So we got a great deal, a number of doctors, because we have like 320, 325 million people in the United States, okay? Now Canada has 2.477, almost as many as we do per 1,000, okay? Let's go over to the UK. UK has 2.8. They have a little bit more than us, not too many more, but a little bit more than us. Now, let's go over to Norway, which is one of the countries that Bernie Sanders brings up and Jank brings up also. 2014, Norway had 4.42 doctors per 1,000 patients. All right? Now, I was also doing some reading here. Some of these studies they've been doing about the waiting times, and this is from the Organization for Economic Cooperation and Development. And this was it's part of a PDF. This whole thing here. Actually, this one we're watching on the screen was posted in June of 2016. And there's also a PDF that I'm not going to show you, but it'll be in the show notes below the video. You can go look at this PDF and see some of the stuff they're getting in there. Over the past decade, many OECD countries have introduced new policies to tackle excessive waiting times for elective treatments with some success. However, in the wake of the recent economic downturn and severe pressures on public budgets, waiting times may rise again, and it's important to understand which policies work. Most health systems with problems with waiting times regularly collect administrative data on waiting times for a range of reasons, evaluation of policies, monitoring performances, etc. However, in general, there is limited comparative data on waiting times from administrative databases. The second OECD waiting time study seeks to fill the existing information gap regarding both waiting time policy evaluation and comparable cross-country data. The publication Waiting Time Policy in the Health Sector, What Works, provides a framework to understand the role of waiting lists and waiting times for elective treatments in several OECD countries. Now, these are all European countries, folks. And they have a list of them down here. The review draws on 13 detailed case studies, mainly written by academic experts, that review policies on waiting times in the last decade in the following countries: Australia, Canada, Denmark, Finland, Ireland, Italy, Netherlands, New Zealand, Norway, Portugal, Spain, Sweden, and United Kingdom. Now, if you go over this PDF, it also has Norway in there. And Norway, even though they have over 4 doctors per 1,000 people in their country to take care of the country, they still have enormous waiting lists. Not as bad as Canada does, but they have enormous waiting lists. And it's just, again, you can go over and look at that PDF and you'll see that. Here's one that I thought was very, very interesting. I never gave this much thought. Socioeconomic status and wait times in Europe, written by Jason Schafrin. Now, this is written back in December 17, 2009, healthcareeconomist.com. And like I said, all the links of these will be below the video after I post them. One of the most contentious parts of healthcare debate in the U.S. is whether or not to move towards a more European style of healthcare. Those in favor cite the quality of the system, the lower cost, and lower administrative cost. Those against rail against the lack of provider choice and the long wait times for many specialist services. Now, I'm going to stop the reading there. One of the Norwegian doctors, she's a female doctor, and I didn't get her name. You can watch the video and get it. But one of the comments she made was that if you're waiting too long at this place, you can opt to go to another place that has a less waiting time, but you're going to pay for that because it may not be on the approved list. I thought it was supposed to be equality for all with the socialized medicine, right? Let me read on here. But do all people in Europe experience the same waiting period for medical care? A paper by Cicilline and Verzulli in 2009 find that individuals with higher socioeconomic status has shorter wait times in Europe. Individuals with high education experience a reduction in waiting times of 68% in Spain, 67% in Italy, 34% in France, compared with individuals with low education. Individuals with intermediate education reports a waiting time reduction of 74% in Greece compared to individuals with low education. There is also evidence of a negative and significant association between education and waiting times for non-emergency surgery in Denmark, the Netherlands, and Sweden. However, the authors didn't attempt to explain why individuals with higher socioeconomic status have shorter wait times. Here are some explanations I came up with. Now, these are just assumptions, but I think Jason makes some pretty good assumptions here. Private health insurance spillovers. Let us assume that the government allocates healthcare resources on a per person basis. Also assume that wealthier individuals are more likely to buy private health insurance. If this is the case, wealthy, educated individuals living in better neighborhoods will experience shorter wait times at the government-run health centers because many of their neighbors will be using privately supplied medical services. 2, buying tools. The government may allocate more health care dollars to neighborhoods with wealthier individuals. Politicians may do this to court the votes and donation dollars of the wealthier voters. Now, folks, this happens all the time. Politicians buying votes happens all the time. It's not just an American phenomenon, folks. Tie-bout sorting. Let us assume that healthcare quality is randomly distributed geographically. Property values will increase in areas with better public health facilities. People who can afford homes, rents in these high-quality healthcare neighborhoods will naturally be those who can afford it, i.e. those with higher socioeconomic statuses. Personal connections is another one. Rich people complain. If more educated individuals are more likely to complain about long wait times, physicians may have an incentive to schedule them first. And the last one is bribe. And Jason asked another question, is there any others? All legitimate thoughts, and actually probably better thoughts and better assumptions than Bernie Sanders' erroneous 36,000 will die without ACA, right? And also, there's another one, I'm not going to get into it because this video is already getting long, but wait times in Canada. And you can go over and watch Steve Crowder, and you can go over and watch some of the other videos that are out there on the internet that talk about the absolute horrid conditions that are in Canada as far as wait times and actually getting things done. And Stephen Crowder's got a couple good ones out there. I know Gavin McGinnis has talked about it. He's from Canada. I think Lauren Sutherland's talked about it. She's from Canada. Almost everybody that's moved from Canada to the United States has nothing good to say about the Canadian healthcare system. And on the next video we're going to get into, we're going to talk a little bit about the cost, because this was a big thing, big issue with Jank and Bernie about how much more ours cost than the rest of the industrialized world. And we're, like I said, we're going to get into that. And this is something that I think you're going to be surprised when I talk to you about some nuances with the cost, how much it costs here in America compared to the rest of the industrialized world. This has been the Dan Clemens Show. I'm your host, Dan Clemens, your constitutional warrior. Remember, if you aim at nothing, you'll hit it every time. Have a great rest of the day, and God bless, and we'll see you on the next video.